Good afternoon, everyone. Thank you for joining PHCA for today's webinar, OSHA Resources to Improve Your Safety Program. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number. I'll be sending a link to a quick survey. Your feedback is very important to us and to our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using the questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Today's webinar is being presented by Dale Glacken, Compliance Assistance Specialist, U.S. Department of Labor, Occupational Safety and Health Administration in the Harrisburg area office. During the webinar, we will look to the concepts used to build successful safety systems used in industry as a tool for creating ideas to help you create a safe and sound campaign at your workplace. The voluntary, comprehensive safety and health management system concepts include the OSHA Voluntary Protection Program, Consultations, Safety, and Health Achievement Recognition Program, as well as others. In addition to help companies tie into established, recognized safety events, Dale will share OSHA's calendar of events. These events are recognized by organizations and industry, highlighting different safety hazards and equipment throughout the year. In conclusion, Dale will end with a short review of what's happening during an OSHA inspection. I'll now turn the webinar over to Dale.
Good afternoon. I want to thank the Pennsylvania Healthcare Association for inviting me out today to talk to you about this opportunity. Thank you for that. Originally, I put this together as an interactive session, so we'll see if we're able to do any interactions with the question pane when we get to a couple of those points. There we go. This topic on systems and safety continues to improve. What we're constantly seeing from industry is new ideas. So we haven't seen it all, and different people have had different ideas. It continues to evolve. So as it does, maybe we'll have ideas from you down the road and others. We're always looking for ideas. So what we're going to go over today is by no means an end-all. There's more to this. Well, let's look at why we do some of this stuff, and why does OSHA want you to succeed, and why are we going over systems to help you with your safety program. OSHA's mission is to look out for the working conditions of everybody in the nation, to make sure we have good safety programs throughout, because for OSHA, people are our mission. And let's just face it, if you have a successful program, you're doing what we want, it's a win-win for us. We don't have to worry about you. The others who aren't doing what's needed may be an area where we're going to spend some time with. And as far as employers, it is the law that you follow the different OSHA rules. It is your responsibility. But sometimes it's better to go beyond the law and look for these opportunities, because the OSHA Act is really a minimum. You can go further than what's in the rules. And that's where a lot of these concepts that I'm going to come to you with today are from. A lot of them are voluntary, and you can take your program beyond just basic compliance. As somebody put it once to me, since the rules are basic, that's the difference between say a lounge chair or a nice chair that you might sit at your workplace to a metal folding chair. The law only requires a metal folding chair. So by having more, that's what we're looking at here. What's the best practice? What can we do above and beyond the basics to improve your safety program? Now, I mentioned OSHA has a lot of different rules, and the rules are very helpful. They give us guidance, and they're important. You have to follow those as well. The concepts we're going to go over are pretty much voluntary, and that's what these are. But I encourage you to do these different principles, and if you master them, you can actually apply for OSHA's VPP program, Voluntary Protection Program, or Consultations SHARP program. Both are very good programs. They allow you to actually continue to work with your employees, create systems for them, and empower them to help you with your safety program. The concepts I'm going to go over were actually developed by a number of different sources, but when you put them all together, they're all very similar. They key off the same elements, and that's what I want to look at. Who else has similar programs out there? And the first one that I mentioned here is a group called the American National Standards Institute. They're the folks who put together rules for safety shoes, safety glasses, hard hats, down the line, as well as equipment such as forklifts. They've also put out what's a good safety and health management system. They did that in cooperation with a group called the American Industrial Hygiene Association, and that's the first one that I've listed. Then there's a second one called the Occupational Health and Safety Assessment Series, or OSAS, and that's an international standard which brings everybody together to create a workplace with safety systems. And then, of course, our voluntary protection guidelines and Safe and Sound, which is a campaign that OSHA has to help do this as well. Every one of these different programs have these same elements. So if you've mastered one, you've pretty much mastered the others as well with a few nuances. Now, each year, OSHA puts together and has what we call our Safe and Sound campaign. That's what we created it for, to help employers learn these principles and apply them to their workplaces. It's good for companies. It helps reduce injuries and illnesses, which helps the bottom line. It's for any size business. I've been in businesses as small as 8 people that have applied these principles, and it has helped their program. I've been in very large companies with up to 6,000 employees who also have implemented these concepts, and it has helped them as well. Now, for this year, the Safe and Sound campaign will be in August, but OSHA has not released the final date yet. So as we go through this presentation, you'll see 2019. That is an incorrect date. I do not have a 2020, or otherwise I would have put it in here for you. It's to be announced. So let's discuss the elements of a safety and health program. And from OSHA's perspective, these all came out of a 1989 Voluntary Safety and Health Programs Management Guideline. It was put in the Federal Register, and it's actually still considered one of the best documents on this topic. I refer to it frequently for ideas. And it has been found that effective management of worker safety and health programs can actually reduce your injuries and illnesses, and that's what we're all about. We're trying to make for safer workplaces. We have a group that follows these principles and have taken it to OSHA's highest level, which would be joining our Voluntary Protection Program. And what we have found, those companies in that program have achieved accident rates, that's their total case rates and their DART rates, half of their industry's average. couple things that it does, just at the 30,000-foot level. It assigns responsibilities and authority to managers, supervisors, and employees. It requires regular worksite inspections to look for hazards and to make corrections, and then to bring things together, orientation and training for employees to not only know what the hazards are, but to know what they need to do to avoid these hazards. You need to have a system for identification and evaluation and control of the hazards, going beyond OSHA standards that were listed earlier, but fixing hazards, even if there's no rule, before an employee is hurt or even has a close call. I've seen many workplaces that only had written programs that were in writing, but they weren't really implemented. They were just a piece of paper. What you need to do in this program, though, is you need to bring the elements into place. You need to make it real. So it's built, this whole concept, from all these different systems that I showed earlier, as well as Safe and Sound, VPP, SHARP, is they're built on these main elements. And there's 4 of them. And this is what we're going to talk about today. There needs to be management commitment and employee involvement. There needs to be a means for worksite analysis, a way to institute hazard prevention and control, and then finally training. So let's see if we can do this portion. On the handouts, on the right side, the one called Safety Program Handout, there's a couple places where you can enter different comments, and we'll kind of work our way through it. But tell me some things that you're doing that shows management's commitment to your workplace. Let's try this out. I wasn't sure how this would work as interactive. Maybe it will work, maybe it won't. But just type your question in the pane on the right side, and I'll see if we can see some of the things you're doing with management commitment to your program, some ideas that you've had. Take a moment for that. Is anything coming in?
Nothing's coming in yet. We'll give them another minute and see if we have any answers coming in. On the right hand of your screen, there's a question pane, and if you would type those in, we do have one. Remove staff from the schedule if they don't complete the training.
That's excellent. That's excellent, because I know it's difficult sometimes with lack of workforce. There's problems there sometimes, and if people aren't trained, pulling them from the roster, that makes good sense. I've been out at one facility. It was actually a medical facility, and if the folks don't complete the required trainings by the end of their cycle, then whenever they come up for promotion, they're actually passed over until which means raise, until they actually complete their required training. So if they don't complete their training, they don't get their eval, and they don't get their promotion or cost of living or whatever. They hold it back until they do so. That's good.
All right. If anybody else has any things that they're doing, please type them in the question pane. All right. We have another one. Sharing safety stories, near misses at monthly safety committee. Committee resolves issues as a team.
That is excellent. That is excellent. When I used to be a safety manager, I had, at my place, I had 3,500 employees, and then whenever I became corporate, I had about 10,000. And what I generally found across the board, when you see that near miss, that's kind of a red flag. If you don't address it, it always seemed that you'd have another one, And if you didn't adequately take care of it, usually the third one was the worst in the set. So I always looked at near misses as a good way of solving problems before they actually did turn into recordables or other problems. And working it as a team that gets the workers involved, that's excellent. That is excellent. That's exactly what we like to see, the employee involvement piece. And I think any successful safety program not only is top-driven, but it involves the workers getting involved and being part of it. And that gives them buy-in, too, a lot of times. That way they know they had a hand in identifying a hazard and correcting it. So those are excellent. Those are very good. What I want to do with you now is just take some time, and I'll go over some things that I've seen over time, and maybe these will be ideas that would be beneficial to yourself. Now, if you take your handout and you go back to page 3, you'll actually see some of the items that I've come up with over time. And this is a dynamic list. I'm always looking for ideas to expand these lists and share, because that way, as a community, we can all get better and stronger. Management commitment and employee involvement are actually very complementary. You can't have one without the other. The workforce and management need to work together to look for means to resolve safety issues. And you may not agree with everything, but the thing is, these two elements work very well together, the employees, management, to resolving safety issues. And if they can do that together as a team, I look at it as you have a problem, and you can either put the problem between yourselves, where you can both sit at the same side of the table and address the problem together to resolve it versus making it adversarial. That way you're working together. And management, what do they bring to the table? Of course, they provide the spark. Without management doing their part, it's never going to work. It can't get off the ground. The employees can't do it by themselves. Management has to approve it, and they need to make it happen. Employees, on the other hand, they have the ability to do things. They need the backing, the approval, the resources, and once they get behind the program, that's a good place to be. You need to get that buy-in, that morale. And I've gone out to places already where management, maybe they switch management, the management's trying to get things going, they can't seem to get it going, and I tell them, the best way to get the workers behind it is to start off with some successes. An employee brings a problem to you, and rather than going on the pile or being addressed next week or whatever, it's addressed, it's taken care of, the employee is highlighted, and then the next one comes along. And at first, there might be quite a few items to take care of, but after a while, and the workforce starts to become part of the whole team, is finding problems and helping to resolve issues, it works as a program where everybody's together, management, the employees working together to resolve issues. So a good thing to do to start out is to actually put together some policies, expressing your expectations, making sure they're realistic for the workforce so that they can do them. With that, setting clear goals so that people know what direction to go, giving them objectives. Also, top management involvement with the program, leading by example. I'd worked for several managers over the years that didn't always stay behind the desk. They would get out from behind the desk. They would go out, they'd meet with the workers, they'd see how things are going, they'd see what was working, what wasn't working. Because sometimes when things are implemented at the top, by the time it gets to the bottom, it doesn't always look the same. And this way, it almost provides a central nervous system from the top to the bottom to see what's going on. But getting top management involved, the way everybody's on the same page. There we are. And get the employees involved in some of that decision making. Safety meetings, that's a great opportunity for that. I always appreciated working with my safety teams. I had several safety committees where I used to be a safety manager. I looked at them as my central nervous system. If something was working, I didn't usually hear that so much, but it gave me a group that I could actually work with to see what would work. If something didn't work, it gave us a chance to talk about it. They were my central nervous system, if something was working or not. As far as responsibility, we assign responsibility and we communicate that, but we also need to give people authority sometimes to do things as well. Responsibility without authority sometimes does not work. You need to have the resources as well to do the job. That's one of the things I tried to do with my people where I used to work. I tried to give them also the resources to do the work, not just the responsibility for doing things. It's also important to have a system to hold people accountable. If somebody doesn't want to follow a rule, you have to do what you've got to do sometimes as far as discipline. That's a necessary part, unfortunately, of the job. But if you don't do it, somebody could become hurt. And then going over the program to make sure things are current, that there's no problems, and that should be done at least annually to make sure that there wasn't a change. And with any of your other systems, isn't that what you do when you don't have something working properly? You go back, you figure out what's not working, you evaluate what you need, and then you make those necessary changes and improvements. You tweak things. That's what we ask you to do with the safety program as well. Keep it alive. Now, here's some of those ideas that are on your handout, and these are some things that I've seen over time. They're ideas for you, but commitment, making safety a top priority to make sure things are taken care of. Planning, figuring out what you need to do, setting goals, working toward those goals. And they need to be realistic goals. It's best if they're documented. The more you do, as far as good planning, it'll help set your stage for how everything else comes along. Now, one of the handouts or one of the booklets that will be included as a follow-on to this session today gets into what's called leading indicators. And if you're looking for help in setting those goals, that leading indicator book actually gets into a lot of good ideas on what works and what does not work in setting a goal. It's called leading indicators, and that'll be a follow-on to this. Create written programs based on hazards at your job site, what needs to be taken care of. Providing resources, and sometimes there's a cost to correct a hazard, sometimes there isn't. And don't look at hazards as a problem, look at them as an opportunity to correct workplace situations so that you can make things better. They're opportunities. Leading by example. It doesn't work if everybody else doesn't follow in. It's top to bottom. Everybody needs to have a piece in this, and the workers watching somebody do something right goes a lot further than not being done properly. Line accountability all the way up and down. People need to be held accountable, not just the workers, but the managers. I was in a plant, and a cardinal rule at the plant was, this was a foundry, if you did not have your safety glasses on in the foundry, that was an automatic 3 days in the street. Plant manager walked out onto the floor, totally forgot to wear his safety glasses, turned around, and the workers were outside the door, went in the office, wrote himself up for 3 days in the street. That was a good example of line accountability. What example would have that set if he would not have followed the same rules as his workers? And these efforts all complement an employee involvement at a site. Also, take a look at your contractors that might be working at your location. Maybe you're replacing lights or whatever the case may be. Are their rules consistent with your rules? You're not directing them, but if you're required to have some type of a control around a certain patient or around a certain situation, and it's for your employees, I would make sure your contractors are following the same rules. And empower your workers to notify you if they're not. Temporary agencies. A lot of folks are using temp workers today, which is good to help the workforce, sometimes as a tool to bring in new employees to see who's going to work, who's not going to work. But within your temporary workers, you also need to define who does what with a temporary worker. I'll use chemicals for an example. If you have chemicals on site, maybe you're using it to clean or disinfect, they need to have training on that. And say there was an audit and the temp worker hadn't received training, that wouldn't be good for the employer or the temp agency. So the best thing to do is to work that out ahead of time with the temp agency. Find out who's going to be responsible for what. Maybe they'll give generic safety training on chemicals, but when it comes to the particular chemicals that you have in your workplace, that might be your responsibility to do that. Or where is that safety data sheet? Who's responsible for showing the temp worker where that's at, or to request information? Somebody has to be accountable for that. And these are the things you work out on the front end with the temp agency. But so don't forget temp agencies with your planning. And it goes beyond hazard communication. Maybe it's bloodborne, maybe it's slip, trips, and falls, whatever the case may be. Temp workers need to be included in the program. Somebody needs to take care of it. And look for meaningful ways for workers to participate in your safety program. Maybe it's problem solving. Maybe you set up a special committee to address a certain issue. Maybe you're having trouble with a certain piece of equipment or a certain facility or a particular item. It may be necessary to put together an ad hoc committee and you work through it. Giving employees maybe an opportunity to do worksite audits. Walk around their facility when they first show up at the beginning of the shift and see if there's anything out of the ordinary, out of the usual. Maybe it's a spill on the floor or a blocked exit or whatever, and that way it can be addressed before there's an issue. Problem-solving groups, they work well. Get them together. And what I found when I was a safety manager, a lot of times working with the people directly out on the floor where the work was being done, it was very beneficial because they actually were doing the task. They had a lot of good ideas, and if it was a good idea, we'd run with it. If it wasn't a good idea, we would explain why. We would close the loop, but we'd tell them why we didn't implement their idea. But they have a lot of great ideas, workers do. Maybe having the workers participate in incident investigations or those near misses. Somebody was almost hurt. What can we do to prevent this from turning into something more serious down the road for somebody else? Or maybe analyzing processes. Now, there's a form that OSHA uses for analyzing processes and has a number of names. One's job hazard analysis, one's job safety analysis, and we'll take a look at that. But maybe that's an idea, having the workers get involved with preparing some of these. Or behavior-based safety, watching somebody else. Maybe somebody sees a coworker, maybe not helping somebody up quite right, and it's putting their own back in harm's way or a strain, and just sharing, hey, can we do it this way or whatever? Behavior-based safety observations. Participation in suggestion programs might be something for the folks. Some places I've gone to actually see if the workers want to help give different types of safety training. I've seen some sites where maybe an employee will say, yes, I'll take the hazard communication program or whatever. And they know they have backing. If they get stuck, there's somebody to help answer questions with them, but they help out with that. And they're recognized for giving that additional help. Maybe it's one of your senior employees, somebody who's been with you for a while, can give that help, as well as with a particular program. And it's important that people know that they can participate in your safety program without any fear of retaliation, bringing up problems. Hey, this electrical outlet's broken, or floor tile's up and somebody's going to slip on it, that they know they can address that, bring it to people's attention without getting in trouble. I've even seen companies where they reward the workers for bringing up issues for correction. And then one that some companies do is what's called a worker perception survey. They see what the workers think of different topics, try to make the workplace safer. Worksite analysis, that's looking for these hazards, identifying the hazards. It's a continuous process, constantly looking for ways to make the workplace safer. So what do you think? Do you have any ideas on what you can do to help identify hazards in your workplace? Tell you what I'll do is I'll keep moving, but these are some things to think about. I would recommend conducting a comprehensive baseline safety and health survey of your workplace to get things started. That way you know where you're at, what you need to improve, wall to wall. Also look at work practices, see how people are doing different tasks. Also, if you're going to use new facilities, new equipment, analyze it. Put that committee together. See what you think. What could be improved? Put together these job hazard analysis. And then once you have the baseline, that gives you something to work from for improvements. You can also then do your regular safety and health inspections, that's follow-ups to see if things were corrected, what needs to be corrected. Maybe there's some new issues. Maybe there was something you didn't have before. Maybe it's a leaky roof, or people are coming in a door in inclement weather, and it's bringing more slippery surfaces, whatever. But there's periodic walk-through inspections. Then once again, the employees having the ability without any fear of retaliation. You can't be everywhere. They're in their spot. The ability for them to report something to you so that it can be corrected in a timely manner. No fear. A reward maybe for pointing out hazards. And this is that opportunity for building success, because if somebody brings a problem to you, it's not resolved, then that doesn't help build the culture. That's really what you're trying to do here, build a safety culture. It's that a recognition of, okay, a hazard was pointed out, it's going to be tracked till it's completed, and then once it's completed, the employee's notified as to what was done about it, or if it's going to take a while, maybe you need to order parts or whatever, but they're part of the process, and you build on these successes, and that's what will help build your culture. Looking at those accidents, what caused it? Then looking at the near misses, same with them. Work through it, look for those causes. And at the end of the day, you take these and you trend analysis them. You see if you have patterns. Oh, it's in a particular building, a particular area. It's with a particular type of equipment. And you look for those opportunities to correct things. When you're investigating the accidents, just backing up to the top one there, don't be afraid to look for that root cause and start out with all the whys. Why did it happen? Who did it happen to? When? Where? And what can be done then to protect others? So ask all the why questions. Do that root cause analysis. Figure out what occurred. Now, here's some things I've seen once again. Conduct that baseline. And to do that, you may need a couple resources. Maybe you need to bring in a consultant. Maybe your corporate office can do it, or it can be done in-house with somebody with expertise. OSHA has a consultation group which works for free. I'll talk about that at the end a little bit, but that's an opportunity for you as well. External help, that would be the consultant. Evaluate the new equipment, or if you're going to change or use a new process. Daily worksite inspections, and it can also be done by your workers right in their worksite. They look at things. They do that during the first 10-15 minutes of the shift, If they have any issues, it gets raised to their supervisor, and then they go back to the shift. But getting the employees in as well, and maybe there's a need to actually sit down with the previous shift and transfer information as to what was going on so that there's no issues. Monthly worksite inspections, quarterly documented inspections, and the value of a documented inspection is it gives you a record of what occurred in that snapshot in time, and if there are any issues, then you can work off of that to correct them. Maybe there's a need to sample for some type of health hazard. That might be an opportunity for you too. And that would be part of your industrial hygiene plan if you have to do any sampling or you have any chemical items, or noise, ergonomics, heat, anything along that line. Put together an accident investigation system. I'd make it in writing, including the near misses, which are not reportable, and trending data. Put that in there as well. Documenting these hazards, tracking them, completing them. Some folks will use the work order system for this whole thing. Now, OSHA has a book called the Job Hazard Guide, Analysis Guide, and it goes through a lot of these very same concepts. It uses a different form than what I'm going to show you here. What I'm going to show you next is a form that I have found that has worked throughout my career, and I found that a lot of companies use this form as well. I'll give you an example. I was getting quite a few accidents where I used to be a manager, and the workers were sent out on a task to actually repair the buildings using scissors lifts and nail guns and some liquid adhesive. And what had happened on this particular day, they were up working on the scissors lift, putting up their panels. Everything was going well, but the worker holding the nail gun actually was holding it with the finger depressed on the trigger, so that all he had to do was put the nose of the nail gun against the wood and it would fire. That way he wouldn't have to keep pulling the trigger. But unfortunately, his coworker lifted the panel up toward him and he shot him in the arm. And rather than reaching down, which he should have, and picking up his radio and asking for help, he reaches for a hammer and he did the unthinkable. He pulled the nail out. I was very disappointed with my workforce, and I came up with the idea that I wanted them all to complete these job hazard analysis, the workers that is, so that they could step through problems, go through what could happen, and look for solutions. I didn't want management doing these. I wanted the workers to do this. After 14 months of the workers doing these, my accident rate went to half of what it had been, because they were having to stop and think and then do, as opposed to just jumping in and doing something. And when the gentleman grabbed the hammer, it showed me they weren't thinking. So what do we have on this form here? You specify your task, that's the job, who put it together, and it's good if a couple of folks can look at it to make sure you didn't forget anything. And these are living documents because I've already completed them. You put it into play, and a week later you find you missed a step or you could have clarified something. Next would be your sequence of steps on the left side, followed by what can happen with each step. And maybe there's multiple ways you could get hurt. And then the right column, what you can do to prevent that from occurring. And you ask yourself the questions, how can I prevent this from occurring in that right column? So you might have one or two steps on a page as you work through a process. And the idea of this is to get people to think through how to do tasks safely. Stop, think, do. That's the whole idea of this, is to get people to think about it. I've seen many industries use this. Here's one from Berkeley, California, the university out there. They also put in personal equipment. I've been out at some nuclear sites, and they actually even add in the need to bring different tools. So they don't want them to get into a job and realize they forgot maybe a 1/4-inch drill on their truck, and they got to go back out through the containment to get that, which is another hour out of the building to go get it. That way they have everything with them. But this is a job hazardous analysis. So we talked about worksite analysis, looking for hazards. Now let's look at the prevention and control piece. So we started out with management commitment, employee involvement. We identified hazards. Now let's fix the hazards. Got to prevent the hazard by using different techniques, and we're going to look at that. One is elimination. That's where you would eliminate the hazard altogether, or if you can't eliminate it, you need to find some means to control it, and it needs to be done in a timely manner. This is called hazard prevention and control. So we talked about eliminating it. You can also use engineering techniques. What can you do to eliminate or minimize a hazard with engineering controls? Maybe using administrative controls. That might be changing a schedule. That might be changing work practices, but it's administrative. And then that all goes to training. Finally, with personal protective equipment being the last item that you would use to protect people. So let's look at these a little bit further. And what I have listed in the left column is what's the most effective to the least effective control, and it's pretty much what we've already discussed, but let's go through them again. Elimination, that would be removing the hazard altogether. Maybe there's no need to do something a certain way anymore, or a need for a certain procedure or whatever. That would be an elimination technique. Second would be substitution. If you can replace the hazard, and I've seen this in my career where we've had different chemicals. We used to have trichloroethylene, very bad chemical. We switched to trichloroethylene. It was a lot safer. Then we started going with the pine sols and the citrus products. Substitution, looking for better ways to do the same thing, but not exposing people to a hazard. Next would be an engineering control, isolating people from a hazard. And probably the most popular way of doing that is to somehow guard it. Is there some way to prevent people from getting hurt by using a guard? Maybe you can't get into or a machine because it's guarded, or maybe you cannot get into something because it's locked, the door is locked, and you might do that with, say, a high voltage power electrical room to keep people who shouldn't be in and out. So that would be an engineering control, as others. There's many. These are just examples. Or an administrative control, changing their procedural. And the problem with these is a lot of times people create a hazard with these. Maybe they don't follow the procedure exactly, or they get things out of whack or out of sequence. That would be an administrative control, and that's why I put it where I do. Administrative would be procedural, but the problem is, and the reason it's not as effective is things can go wrong with it. But sometimes that might be the only thing you can do. You're stuck, and that's what you have to resort to. Then, of course, there's personal protective equipment. I put that low on the chart as well because it doesn't actually remove the hazard. It just puts a barrier between you and the hazard. Safety glasses, they don't remove the hazard. They just put something between you and the hazard. Putting on a pair of gloves doesn't remove the hazard. The hazard's still there. It's very close to you. It's about the thickness of a piece of newspaper away from the hazard. That's how close you are. And if it rips, that's not good. So that's why I put it at the bottom of the list. If you can solve a problem another way, that's best if you can. That's what it is, if you can. And what brings this all together is the training piece. Because if you're not training people to follow the procedures, or how to use that guard properly, or which chemical they're supposed to use, none of this works. They also have to be trained. That's a very important part of the hierarchy of controls. Preventive maintenance is very important too for your facility, whether it be air conditioning systems, heating systems, water distribution systems. Maybe it's just the carpets on the floor, or how water gets drug into the facility, a kitchen area, whatever the case may be. Preventive maintenance. You need a system there to make sure things go well, and somebody's actually inspecting to make sure there's no problem. emergencies, we haven't talked about that, but what can go wrong? And once you decide what all of your issues are, I'd make a list of what type of emergencies you might have, and then figure out the actions that are needed to be taken. Who's responsible then for what? Where's your designated meeting location? And put that in what I would call a grab-and-go book. We've even done this at our local OSHA office. We have grab-and-go books. Something goes wrong, we grab the book. They're at each exit. We know who to call for that particular issue. We know where our rally point is. Everything's laid out in this book. It covers a number of different issues. How to shelter in place if you can't leave. A fire, of course, you're going to leave. Shelter in place. Maybe you have an issue with an active event of some sort. So definitely spell these different emergencies out, come up with some plans, responsibilities, contacts, meeting locations. Very good to do. And then finally, to make sure that works, test it. Do a drill every now and then. Document your test. It shows you've done this. Medical program is first aid on site. By whom? Who can do what? What can't you do? And I know we have a new thing with first aid and CPR training. It's now called Stop the Bleed, and that addresses how to actually stop a very severe injury where you might have to either use a tourniquet or stuff the wound. But I would not recommend that without the proper training. But some first aid providers now are providing the Stop the Bleed as part of a follow-on to the first aid training. So let's just take a look at that list again. As I said, it's in your handout, but put together a system to not only identify, but to track hazards all the way through their correction, and a means to notify the person who pointed it out so they know the item's been taken care of. And this is a good way to build your culture, to show folks that you are serious about safety, that you're willing to correct hazards in your workplace. Use this hierarchy of controls to fix problems. If you get stuck, go back, look at them, work your way down through. Can we engineer it out? Do we got to change work practices? Have we trained the employees on these yet? And sometimes you have permanent solutions that take a while. You may need to institute interim solutions until you can actually put the real solution in play. Make sure your controls are appropriate to the hazard, that you haven't created a new hazard. As far as written programs go, consider developing them for your different programs. Look at your emergency preparedness. Make sure you are for different emergencies. And there's a number of resources out there under ReadyGov, which is the Department of Homeland Security, as well as OSHA for ideas for what you can do for these different types of hazards. And we'll talk about that in a moment. Get your employees involved, buy in with your safety program, and look for that continuous feedback. If you don't provide that feedback, if you don't correct hazards, you're going to kill any chances of creating your culture. And then, unfortunately, you may have to have some discipline in your program just to make sure people are doing what's needed to work safely. Documented preventive maintenance program, an occupational care program. How do you work with an injured employee to make them whole again and prevent that from occurring in the first place? And this all kind of wraps up in the training parts, where the employees know their hazards, how to protect themselves, where anybody can walk up to an employee and say, this is what's wrong, what do we do about it? And they all have the answers. Everybody's empowered. They know what to do. They also know their rights and responsibilities to work safely, and they also know what systems. Somebody's hurt, who do I report it to? Where do I go for help? We have this problem. There's a suspicious person outside the facility. Who do we report this to? We're having trouble with heating and cooling. Who do we report this to? And if it was covered by preventive maintenance, it would have been fixed before the season goes bad, where you have to worry about heating or cooling. But who do I report problems to? But those are good things to have. What else for training? It's for all personnel. Everybody needs to know the expectations. Even a new manager. I've seen companies get in trouble. They bring in a new manager. Oh, he knows how to do this stuff, but he doesn't know your site rules, and that's gotten them in trouble. So make sure even your new managers receive the training. Workers get it in a new orientation, new hire orientation. And don't forget the worker who's been with you for a while. You've made changes to your program. You need to back up and bring them up to speed too. Training and all this safety stuff, it should not be an afterthought or an add-on to your programs. It should be integral. It should be part of your whole system, including everybody should be part of what you do. The complexity of your training and all these different programs, you would go with your hazards at your work site. It might be different from one facility to another based on what you have at that location, number of people there. And these are living documents. Always look for ways to make things better. Management's very important in this whole process because if they don't understand the expectations, then it's not going to make it to the workers who work for them. And I've had a few managers in my career that I've had to retrain so that we didn't have any issues in their particular departments. And whenever I found I was having accidents constantly in a certain area, I didn't always look at the employees. I looked at the root cause. Maybe the manager didn't get the word out, or maybe they just didn't always enforce the rules that they were given the charge to work with. So they're, first of all, here they're responsible for analyzing and identifying hazards in their workplace, making sure the protections are in place and their workers are knowledgeable of these practices as well as enforcing them. On the employee side, they need to make sure they understand what's going on. So look for that feedback for them. Look for that worker perception survey. Possibly have a hotline number for them to call in to say, hey, we don't know what's going on here. Can you help us out? And many times an employee just wants something to be right so that they can work there safely. They're not trying to cause problems. Many times an employee will call our office and say, I don't want to get my employer in trouble, but can you help us get this fixed? It's all I want. I like working there. Can you help me? And yes, they do put in a complaint. Many times they're what's called a non-formal complaint. We'll call the employer, go over the hazard with them over the phone. You get back to us, you tell us what you did to take care of it, and that's the end of it. It's taken care of. But make sure you're taking care of things for your employees. Many times they're not trying to cause any problems. They just want something fixed so they have a safe workplace. Let them know your expectations. Let them know about your safety and health systems. Employees, at that orientation, try to hit it all. But it's a lot of times when you have a new employee and you're hitting them with a lot of procedures, it might be one of these things where you phase different things in as they learn your processes and you give them more and more responsibility. Things to cover in your training, that they know their rights, they have rights, responsibilities, how to recognize hazards, how to protect themselves, what training is required by the different standards, if they do have an accident, that they need to report it, what to do for an emergency, and maybe you have some type of a spill on site or an issue, what they need to do there. A good tool for you to understand and go over the rights with the employees would be to use your OSHA poster, and that's the poster on the right. There's many different versions of this. It has the employee rights and responsibilities on it, and it serves as a good tool for training employees. And that's what I point employers to whenever they go to give this type of training. You should also have this in the workplace in a conspicuous location that people can see it. What I used to do, I used to tell my employees, bring me the problem, let me try to address it, let me fix it first, give me that chance. And a lot of them trusted me, they'd bring me their issue and would work through it. And And that's where you build that relationship, where they're not afraid to bring something to you. I've had some companies say, no, our suggestion box is always empty. We check it, it's anonymous, but people feel so comfortable working here that if they have a concern, they'll bring it to our attention while we're here. And that's a good relationship to have. So here's the idea sheet for this one. Make sure you train all of your employees and the managers. Make sure employees know their rights and responsibilities. Make sure you're giving new employee orientation and awareness, and don't be afraid to catch up with that information with your existing employees. And it's sometimes good to revisit some of the stuff on a yearly basis anyway, so that they know what's going on. Make sure they understand what their worksite hazards are, or what would be worksite hazards. Maybe walk around the facility, take some photos, put together a PowerPoint, put it in a new orientation to say, these are some problems we typically have, and this is the solution. That way they know what to look for. What's the hazard? What's the solution? Maybe go over this hierarchy of controls so that they understand, maybe empowering them so they can help you resolve problems. Giving training specific to your hazards on your site. And make sure everybody's been trained. You have an accountability system, a spreadsheet, a database to do this in. Safety committee. If they're party looking for hazards, make sure you're giving them training on how to find hazards. Once again, somebody points out a hazard, take a before, take an after. Use that as training opportunities for folks. That way you don't have to go through it every time. You just go through your PowerPoint, go through what you're seeing, what's the expectation. Bring in temp workers, contractors. You can use the same information for them. And don't forget, not everybody speaks English, so it might be necessary to give this training in multiple languages. Now, OSHA put together the Safe and Sound campaign, and the idea of this program is to get companies to do something to improve their safety program. This isn't just a one-day or a one-week issue. This is something that should be worked all year round. You come up with ideas, and I'm going to give you some resources where you can get ideas, and you, as well as what we've looked at here today, you work those ideas, you put together a plan, maybe it's a monthly plan, and you implement it. And then each month you do a little more and a little more, and then you finally get to the end of the year, and that's when you do your big stand down for safety with everybody, and then it all starts all over again. And each time you're continuously improving. That's the idea. And this is a nationwide event, and we're asking everybody to do this. We've got, as I said, suggested activities for management, employees, finding and fixing hazards. That's what it's all about. Now, this booklet on the right is also one of the links you'll have following the session, and it's full of these types of ideas as well. I have many resources that dig into this information. And here's those core elements again. But at the bottom, they add a few that we didn't actually talk about, and that's that evaluation, doing that follow-up, make sure you've done things. That's your follow-on evaluation. And if you have different people on your work site, make sure they're aware of your hazards as well. As I said, this is a journey. So as you see in the diagram, these months they did one item, next month they did another item. They worked their way up to the Safe and Sound Week. Plan out the events. Involve the workers. Get your safety committee involved. Build up to that week. And share the results with the employees, not just those on the committee, but everybody. I've seen companies already where they'll meet with, maybe it's the leader, we'll meet with different pockets of employees over a year period, a week at this work site, a week over at that, until they visit all the work sites. They get it one-on-one time with just the workers, not the manager at the site, and that way they get feedback. It's not to give the manager a hard time, but the intent is to, what can we do better here? What can we do better? How can we grow? So if you're ready for this, and your company has less than 250 on site, which I believe you do, and less than 500 in the company, that I cannot account for, you can actually ask Pennsylvania's consultation for assistance. Who pays for these folks? OSHA picks up the bill. What we do each year, we give each state money to run a consultation for a program. This is a free consultant to come come out and help these smaller employers improve their safety program. The state then throws a little more money in the pile, and then it goes to consultation. For Pennsylvania, we've used the same group for 35, 36 years. It's the Indiana University of Pennsylvania, and they have a trained safety staff of seasoned safety professionals come out and help you with your safety program. There's no fee for this service. All that we ask is if they find a hazard that you correct it before they leave. That's called Pennsylvania consultation. These are not college kids. These are not college professors. These are safety professionals who've been doing this for years. If you do good on the audit and ask to be considered for what we call our Safety and Health Achievement Recognition Program, or SHARP, they'll evaluate you for that and put you in for it. If you are a SHARP site, you are exempt. Now, this is site by site, so it'd be each establishment that you have. You have multiple establishments, I'm sure, but each establishment can apply for this, and it would exempt you from a programmed OSHA inspection for 3 years, because we're trying to encourage people to do the right things with their programs. If you do these elements within what we call our VPP program, and if you were interested in VPP, you're in South Central PA, I can come out and go through what all you would need to do for your site to be in VPP. It's the same concepts that we went through, and I would go through what you need there. But if you apply for VPP, the same thing exists with this particular program. If you have all of your elements in place and we're satisfied with what you have and become a VPP site, you would actually be exempt from an OSHA inspection for 30 to 42 months initially and then 60 months follow on. But you have to maintain these programs, and we're looking for continuous improvement, employee involvement, management commitment. So do something. Don't just be stagnant with your safety program. Now, I have some resources for you today, and I want to kind of run through those. The other attachment is a calendar of events. What I've done is I've gone out to all of the different organizations that I'm aware of that do different safety functions, whether it be a ladder safety or American Heart Association or the suicide prevention folks, and I have taken their big week that they're pushing the particular issue, and I put it on a calendar, and that's the calendar that's an attachment. If you click on any of those links, it'll take you to that month, that week, that activity. And so what you could do if you wanted and you were looking to put together a calendar for yourself, these are some items that you can add to your required items as you work your way down through. We put this out. I put this out each year to try to help you with your safety program, and that way you go over and let's just pick on ladders for a minute. You go over to the Ladder Safety Month. There's several things you can pull from that for your safety committee. You can use some of this for maybe your home safety or your maintenance folks or whatever. But that's the idea of this, is to give you resources to know where to go for things to help you out with your yearly calendar. We also have on the OSHA website many resources. It's just www.osha.gov. You can always call the OSHA staff duty officer. They're on call Monday through Fridays on standard work weeks from 8 to 4:30 throughout the state to help you answer questions and take care of things. We also put out a bi-weekly newsletter that you can subscribe to. You subscribe to this, we'll send you this newsletter. You can unsubscribe anytime, but it tells you what's new with OSHA. We also have publications on our website that you can download. We did talk about consultation. And of course, myself, I can work with different groups and pockets of people, as well as the VPP program. Publications, as I said, they're on our webpage. You can download them. They're free and open to the public. Excuse me. Regarding OSHA's consultation program, as I said, it's free, funded by OSHA. You have to have a commitment to correcting what was pointed out, and we work with different sectors. You'd be in the services sector. So last year throughout the country, $10.6 was in the service sector, helping folks get it right, not citations for this. This is, going out, pointing out issues, and folks correcting hazards. This is the size of the different companies that we've worked with within this program. As I said, less than 250 on site. The bulk of what they found were safety hazards, but there were health hazards as well. And it resulted in correcting quite a few hazards to protect the workforce. This is how you would reach consultation. This is their phone number. And what I'll do is I'll make sure PHCA has my presentation so that you have this contact information so you can reach them. It's also on the OSHA website. If you say, hey, I have folks in other states around me, Maryland or Virginia, who do I contact there? We actually have consultation projects in those states as well to try to help you. And something that's new, OSHA and the state of Pennsylvania have gotten together. We've signed an alliance to work together. And the state has plenty of resources as well. You're looking for resources for your safety committee. Yes, OSHA has some PowerPoints and some videos. The state has lots of PowerPoints and lots of videos to help you with your training. And that would be under some of the resources on the right, as well as for your workers' comp. If you have a certified safety committee, you can get 5% back on your workers' comp, which is a good deal. But we're not talking about that today. But if you need information, I can point you to WordThat, which is another good program. OSHA's put out this piece on our website to help employers understand what protections they have and what the requirements are, as well as a page for employees. And here's that calendar of events. So as I said, you click on one of these blue topics, it'll take you right to the organization that'll help you through it. Here is the state of Pennsylvania, how to reach the different area offices. I'm out of the Harrisburg office. I have 14 counties. I work for Mr. Ola. But here you can see the contacts for the other offices if you're trying to reach them as well with a question or a concern. Regarding OSHA's inspection process, I'll just make a few comments about that. Essentially, there has to be some reason that OSHA shows up for an inspection. Either you show up on a list, what would cause you to be on a list. Maybe you did not electronically submit your OSHA 300As into the system, and you were supposed to. Well, if you were supposed to and didn't, then you would fall under what's called our SST 16, Site-Specific Targeting 16. It's based on 2016 data. So you have to the 2nd of March to get in your 2019 data. So you don't want to be targeted because you didn't input your data into that system. Another thing that might cause OSHA to come out would be a complaint, somebody putting in a complaint, whether it be a formal one or an informal one, or a referral of some sort from a medical facility. So things to think about. OSHA shows up, they'll explain why they are there. Ask them if they don't show you their credentials. Make sure you look at their credentials to ensure they are who they say they are and that it is really somebody from OSHA. And they'll go through, as I said, why they're there and begin with the inspection. They'll walk around the facility. If they see a hazard, they may take a photo of it. They may document it somehow. They may talk to the employees privately as they go through. Then at the end of the audit, and maybe they're there for more than one day, maybe they need to do some sampling and come back with some sampling media. But whatever the case may be, when they're done, they do an out briefing, a closing conference, and they'll go over what was found. And if you have any questions or something else, that's a good time to show it to them before they leave. Make sure they're aware of what actions you're taking. And then, of course, what would happen, you would receive the citations in the mail, certified. And at that point, you need to decide how you're going to proceed. You can take care of the items. Sometimes they offer a enhanced settlement offer right through the mail that's sometimes offered, or there's also the possibility that you come in for an informal conference. There's no harm in coming in to discuss the items further. Lastly, if you want to contest, you only have 15 days once you receive that letter to do something about it. But if you decide to contest, you have to do it within the 15 days or it becomes final order. If you do contest, then an administrative law judge gets involved, and it could even end up at the highest level, the Occupational Safety and Health Review Commission, but you have rights as well. What OSHA sends out with each citation is an employer's rights and responsibilities as part of the follow-on to the inspection, so you know what you need to do. All of the results for OSHA inspections are on our OSHA webpage, so you can pull up your company or anybody else's company, for that matter, on our webpage to see what has been cited in the past and how things came out. And that's pretty much all I had. Any questions for me?
Thanks, Dale. That was great information that you shared today with us. And we are taking questions at this time, so if you do have a question, please type it into the question pane on the right hand of your screen. We'll give it a minute and see if there are any questions. In the meantime, we have a lot of webinars scheduled for the next several months. I'm working on scheduling through May right now, so keep an eye out for upcoming webinars. We have several on workforce and several others that you all might be interested in. So keep an eye out for those. Like I said, we are scheduling into May right now. And if there are any webinars that you would like us to consider, be sure to fill out your survey that you'll receive later. And there is a field to submit suggestions for training. There was a lot of information that Dale got out today, and I'll be sending links to the handouts, as well as Dale provided links, web links to many different resources. So I'll be including that information in the follow-up email that you will receive. All right, this is a pretty quiet group. I think you covered things so thoroughly, Dale, that they're not having any questions. I will also include Dale's contact information, so if you do have questions that you think of later, you know how to get in touch with him. All right, I think we'll wrap it up. Thank you again to Dale for presenting on this really important safety topic today, and I just want to wish everybody a great remainder to your day.